Dạ. Test, test. Assalamualaikum warahmatullahi wabarakatuh. A very good afternoon, ladies and gentlemen, doctors, and all my colleagues. I'm Amelinda, junior resident at Department of Physical Medicine and Rehabilitation, Sutomo Hospital. It is my pleasure to be conducting today's event. On behalf of Physical Rehabilitation and Medicine Department, University of Erlangga and Sutomo Hospital, I would like to extend a very warm welcome to our beloved senior doctor, Dr. Bayu Santoso, physiatrist, neuromuscular consultant, and our beloved teacher, Dr. Abdul Jabar Al-Hayan, physiatrist. And here with us today, we have our honorable guest, Professor João Pedro Arauzo, medical doctor, physical medicine and rehabilitation specialist, sports medicine specialist. Professor João acts as a Viva medical officer, as clinical and performance director of Sporting Club G Portugal, and football medicine founder. And we appreciate you taking time off your busy schedule to join us here, Professor Zhou. Before anything else, may I invite everyone to invoke the Almighty for blessing us. And so we are gathered here to join an academic lecture about clinical experience in the field of physical medicine and rehabilitation, sport medicine. Next, we have first the pleasant opportunity. Please welcome our beloved senior staff, Dr. Bayu Physiatrist Neuromuscular Consultant, to say some words. Time is yours, Doctor. No, Doctor. No, Doctor.
Okay, thank you very much. Very, very good afternoon to all of you, and especially to our guests from Ronaldo's country, from Portugal. Is that okay? He is very, very glad that he's from the FIFA organization, the Football International Association of the World. And he's representing also Viva, not only from Portugal. And we are very, very happy here because at this time, the World Cup FIFA U17 is conducted here in Indonesia. Last week, I saw the football, Indonesia against Panama. The score is 1-1. And the last one, unfortunately, Indonesia lost to Morocco, 1-3. So we still third, although we lost the FIFA U17, we still 32 team in the World Cup. Nah, itu oke. Jadi masih 32 besar kita itu. Walaupun kalah, memang semuanya 32 ya. Lihat nggak? Duh, saya dikasih ini kan gara-gara itu. Okay. And I'm very, very, very happy that our guest is also a physical medicine and rehabilitation specialist, especially in sport medicine. We are very, very happy because sport Indonesia right now, especially football, is a very, very popular here in Indonesia. So we hope that we will have something from our guest. It's very, very good information about the sport in general, and especially maybe for football. Is it?
Yes.
Okay. So welcome to our country. Welcome to Surabaya, and welcome to the Department of Physical Medicine and Rehabilitation, and all staff and also residents coming from all over the Indonesia. Okay, we have how many residents now? About 80, 90 percent. Okay. Okay. So once again, welcome. What's your name?
Joao.
Joao.
Okay.
Dr. Joao. Okay.
Thank you.
So big hand for our.
Thank you. Thank you.
Thank you very much. Thank you
you,
very much.
And now I would like to invite Professor João Pedro Arauzo, medical doctor, physical medicine and rehabilitation specialist, sport medicine specialist, to join us here to deliver the academic lecture about the clinical experience in the field of physical medicine and rehabilitation, sport medicine. The time is yours, Professor.
Thank you very much. Thank you all for me. And first of all, I want to ask you, if I speak too much, please you just tell me to stop, and I will stop. I want to respect and appreciate your time. And I'm deeply thankful for your invitation. And I must say this because, okay, we are in the work there in the stadium. I speak mainly with not so many people from Indonesia. We are all over the world there. But what I feel in this country is very special, to be totally honest. It's really impressive the way people are so warm here. And I feel truly welcomed in your country. And I'm very, very grateful for this. Thank you so much. I've been in so many countries, and for sure, the people of Indonesia, they are ranked first. They are amazing. I hope also in my country, everybody could be the same, to be honest. You are very, very warm. And everybody has a smile. It's really, really nice to be here. So thank you so much. I would like to ask one thing first, just to have also physiotherapists in the room, or it's mainly we have physiotherapists and doctors, or it's only doctors, or both?
I've even invited the physiotherapist, but I think they are watching through.
Okay.
The
So just for me to know the audience, so then I can. So I see that. Can you put the next slide? I think it looks better. So the first thing, and doctor was totally right. I see that sports is growing in Indonesia, not only, and Indonesia is a huge country. No, in Portugal we are very, very small. We are only 10 million, so we are nothing. 10 million. Here is 200. It's 20, more than 20 times Portugal, and also the country is very big. With Portugal, we are very, very tiny, but the country. And it's good that sports is growing, because everybody understands now more and more how sports is the #1 thing that you can do for your health. Okay, it's even more important than the diet. More important thing to stay healthy and to live long and with a good health is the sports. And second, or almost the same, is this social connection that we have. These are so important. I think the social connection, Indonesia, you already have this, which is very good. But sports, maybe also you can still have a long way, so that everybody knows and understands how important the sports area is. And if the sports comes big, then it's important also to have people to support these people that are making sports. And normally, I don't know here, but I feel it's the same. In Europe, the medical school doesn't prepare you to be a sports medicine doctor. So you really need to take a specialization in sports medicine. And for me, my path was first, I went for the physical medicine and rehabilitation specialty. It was 4 years. And after this, I went for the specialty of sports medicine. So each one of you that are in physical medicine and rehabilitation, I think if you want to go to sports medicine, you are in the right place now. First, finish your rehabilitation residency program, and then sports medicine. In the past, maybe 10, 20 years ago, it was more the orthopedics that were taking care of the sports medicine. But this changed completely, all over Europe. And this for one reason. The main reason is that the orthopedic surgeons, they don't have time for sports medicine. They need to be in the operating theater. But maybe the most important thing is that 99% of the injuries in sports are non-surgical treatments. So you need to have a good physiatrists and good physiotherapists to treat most of the most common injuries that will affect players and people. So for this reason, I bring, because my background is physical medicine rehabilitation, sports medicine, but then for the last 20 years, I'm working mainly with football. So my mindset is a lot towards football and football injuries. And thinking about that, but not only, because it's a very common injury in any kind of sports, is the muscle injuries. That's why I bring a lecture on muscle injuries, because I think it's a nice topic to bring in. Because every people that doing sports, probably at any stage of their life, they will have a muscle injury. And I don't want to disregard orthopedic surgeons. They will not care about this. So muscle injuries, they should go through a good rehabilitation program designed by physiatrists and together with the physiotherapists. So the next one. So I will try to answer this quickly. And please, if you want to interrupt me, you can interrupt me at any time. I don't mind. You can put questions at any time. If it's a conversation, for me, it's perfect. So what is a muscle injury? One of the first things we'll see, obviously, why they are important in football, not only in football, all sports, but why they are important. I kind of already answered this question, but let's go. Why they happen? Why some players, they don't get muscle injuries, and what you can do to prevent? Are muscle injuries all the same? And how should we treat a muscle injury in a football player? This will try to answer all these questions. It will take a little bit of time. If you see that I'm taking too long, please let me know. So I can pass here, no? This one. Yes, back. Thank you. Sorry. So a muscle injury lesion is identified by the loss of functionality of muscle caused by damage on a level of muscle structure or on a level of anatomical signs assigned to transmit strength. We'll see better what this will mean. But this means that a muscle injury is not only when we see an imaging that shows that there is some issue with the muscle. No, at the same time, and because also we are physical medicine rehabilitation doctors, we understand this, the function, it's very important. Okay, only when there is actually an injury with a loss of functionality, then we think about the muscle injury. If there's no loss of functionality, we will not say it's a sports muscle injury. And we are in an area that, sorry, you can go on. Yeah. Oh, back, sorry. So nowadays, and here this ultrasound, and ultrasound, obviously for me, for physical medicine rehabilitation and for sports medicine, is the stethoscope of the cardiologist. Our stethoscope will be the ultrasound. I work with ultrasound on a daily basis. And I think if you are on the musculoskeletal specialty in rehabilitation or sports medicine, one of the things that you should try to learn and do some courses later on is on ultrasound. It's really, really important. And is always besides my bed. So any patient I have, obviously, first I will go for the physical examination. The history that the player will tell you, it's maybe 80% of the diagnosis, or 70. This will bring maybe 29, or get it together with the history. The clinical examination is everything. Then the imaging will help a little bit. Don't forget this. Don't go immediately for the MRI of ultrasound. Still, clinical history, listening to the patient, and doing a good physical exam will give you almost everything. Can you just put the this running. I think. Just okay. Sorry, one back. So the clinical the clinical history of a muscle injury, obviously, normally it's easy to identify, and we will see. So in a football player, normally it will be the hamstrings. That's the most common. We have, but we will still have adductors, we still have quadriceps, and we still have calf. That's the main. And normally they will bring you a very nice story for each one, and you will be able to identify immediately. But after, we will see. Then after the history, we'll take the clinical examination. And the clinical examination of muscle injury is really simple. Only 3 things you need to do, but you need to do this, okay? If the player tells you that for instance, this player, he has a pain in the hamstring, so first you go for palpation. You see, okay, it's here, okay, and you detect where is the pain. You are not looking for gaps, nothing like this. You are looking for the pain. The gaps, you can't feel it. You just look for the pain. After, you must know then you have to have a good knowledge in anatomy. You need to know where is muscle origin and insertion. After this, you know already how to stretch the muscle and how to make the muscle contraction. You can do here in close kinetic chain, open kinetic chain. You can do what you feel is more comfortable according also to your experience. But those are the key points for a good clinical diagnosis. Always muscle injury, palpation, range of motion, and strength. With this, positive, you say you have a muscle injury, okay? So next slide. So you see, in the first moments of a hamstring injury or any muscle injury, the clinical examination is the most important, immediately after the injury happens. Of course, in a hospital is different because you don't see immediately the player, but when you are working with a sports, maybe you are there and you can see. So in the first moment is the clinical examination and the clinical history and the physical examination. Only after we will go for the ultrasound and probably the MRI if you can do. But if you are highly experienced in ultrasounds 90% of the times will be enough. Okay, that's why I think should all try to do a course in ultrasound. And you can start to see some changes after 24 hours, but to have a good ultrasound imaging for a muscle injury, we normally require 48 hours, 2 days. Then you can have a very clear view of the problem. So next one, please. Why they are important in football? Please, you can go again. So this is my club, for instance, in Sporting Lisbon, and I can bring other clubs, but you can see from previous seasons and also this season, muscle injuries, they are more than half of the injuries. This means when the patient comes to me, more than half of the times is a muscle injury. That's why it's so important. So on a daily basis, our biggest problem are not ACL injuries or meniscal tears or shoulder dislocations, no, or back pain, no. Our main issue are muscle injuries. And effectively, we try to design to prevent, but they are still growing. So we still have this problem. Another one, please. So that's why nowadays we call it the injury burden. You will start listening a lot this word. Is the injury burden. Okay, this is the severity of the injury. Obviously, ACL, it's here. So it's very severe. If you have an ACL, you'll be away a long time. But then here is the incidence. And the incidence of ACL we do nowadays is becoming less and less. But muscle injuries, they are, especially hamstring, they are still here. So there are a lot of, the incidence is very, very high. And the burden and the severity can be quite big. Even some players, sometimes they go for surgery and they can stay 3, 4, 5 months out of competition. So we can see here the bigger the problem. So you can see hamstring muscle injury. It's the biggest problem in terms of burden in football nowadays. This is Champions League, Premier League. The biggest problem for us, team doctors, hamstring muscle injuries. Next one. So still here with the football developing and people becoming, you will have people practicing more and more football, expect to see a lot of hamstring injuries. And some of the hamstring injuries, they can really finish a player's career. If they are not treated well, the players can finish his career. So obviously we have other location, but still hamstrings are always the main one. Next one, please. So in a team of 25 players, probably you will have around 20 muscle injuries per season. It's a lot. Okay. Next one. So why and where the muscle injuries happen again? So this is a concept that is very important for anyone dealing with musculoskeletal problem. Can you go a slide more? Just one, no, up. No, sorry, back, sorry. No, I will. Another no in front. No, I'll go for the same. Sorry. Next. Okay. Then I will address this. So this is not only for muscle. This is for musculoskeletal tissue. Either is muscle, bone, tendon, aponeurosis, cartilage. Anything can get injured when the loads exceed the mechanical limit. And this you need to put in mind. No? If the tissue is not prepared to receive that load, it will break, it will have an injury. Doesn't matter if it's bone, you have a stress fracture. If it's a tendon, you have a tendinopathy. If it's a muscle, you have a muscle injury. So what this means, already you can think, the way you can prevent this is you can control the load, so you never exceed the mechanical limit, or you can increase the tissue strength. You have two ways to go, okay? But this, you have to bear in mind always, any MSK injury, load should be on your mind. Why did they get injury? Why the loads exceeded the mechanical limit of the tissue? This is always important. So normally, and because eccentric contractions are much stronger, because normally they recruit fast twitch fibers, and they also, the strength generated by the passive elements, normally a muscle injury occurs during eccentric contraction because the forces are higher. So another one. And this is, I put here the typical injury mechanism, and you see the muscle group, hamstrings, quadriceps, growing, and calf. Because this, when the player goes in your office and he tells you, doctor, I have a pain. So what happened? So I was sprinting, and immediately when he says sprinting and he says he feels pain on the back, you think about hamstrings, okay? There are stretching mechanism is also possible. So if he speaks in sprinting, you will look for the biceps femoris. If he says it was like reaching a ball like this and he felt pain, then it will be membranosus. But when he's sprinting and he's running and suddenly, this is a typical hamstring injury for biceps. Sorry, back. I make a mistake. Yeah. So if it's stretching, normally semimembranosus is affected. And only with this, already you have a diagnosis. Then you confirm with clinical examination, ultrasound. For the quadriceps, he will tell you, I was shooting the ball and I feel pain here. So normally rectus femoris will be involved. Also possible to be in sprinting, but much less common. Normally quadriceps and rectus femoris to be on shooting. Growing, especially shooting and change of direction. Calf, acceleration, when he accelerates and he feels, or when he breaks. Then normally you will see the calf injury. So this is important to know this mechanism, understanding, already you can direct your diagnosis. Next one, please. So, and before studying muscle injuries, my concept, okay, a muscle injury is an injury in the muscle, in the middle of the muscle. That's what I thought, no? But then when we start studying, we see that is not that. So they happen in the places where the strength is more assigned, and normally is in the myotendinous junction. So what this means, normally an injury will occur in the transition from the muscle to the tendon, or from the muscle to the fascia, or from the muscle to aponeurosis. This is important. When you are doing ultrasound, you don't look to the middle, to the muscle belly. You will go for these bridges between muscle and tendon, muscle and aponeurosis. So myotendinous junction is one of the most common places. So next one, please. Why also we see that some muscles, they don't get injury, and also the injuries are so frequent. We will see that biarticular muscles like rectus femoris, like hamstrings, or like gastrocnemius, they will have more injuries because they are biarticular. So biomechanically, it's much more demanding. They have to play with two joints at the same time. Muscles high, also with a higher proportion of fast contraction fibers, and muscles, as we saw before, with a higher eccentric activity. That's why some muscle gets more injury and others don't get so many. Another one, please. So are all muscle injuries the same? Let's go. And they are not. So, and when I start, it was 20 years ago, when I started studying this, we had 3 grades only. It was grade 1, grade 2, and grade 3. Minor tear, partial tear, and full tear. That was like this for a long time. Suddenly, everybody starts studying muscle injuries. They start to be important. Many people from physical medicine rehabilitation, physiotherapists, they start studying this. And also people from the imaging. And then many classification systems, they start coming. This is the last one that we are using more. The British Athletic Muscle Injury Classification. The only problem of this classification is that it requires normally an MRI or a very experienced ultrasound, because you need to know exactly which place, because it classifies according to the place of the injury. If it's between the muscle and the fascia, we call it myofascial, and they give A letter. A B letter if it's between the muscle and the tendon, so it's myotendinous, and a C letter if he has already the tendon affected. If you are curious, you can check this. So next one. What can we do to prevent muscle injuries? So this is the pyramid. Sorry, I put this here because this is like one blog that I make with my friends from all over the world, people that have interest in football medicine. Then I will share with you the website, and you can have all this information here. So there are many risk factors for muscle injury, but you see people say, I didn't warm up. The warm-up was not appropriated. This is only here in the top. It can maybe affect a little bit, not too much. The posture, possibly. You know, the other core stability, other things. The most important thing is load management. So when a player is coming to you with a muscle injury, you have to ask him, so did you do anything different this week? Was your training strategy the same? And 90% of the times the answer will be there. Okay, then other important things, muscular strength imbalance. If you have a previous muscle injury, you are more prone to have more injuries, of course, and then you cannot modify this age. You can do nothing about it. So this is the injury load. It was in the wrong place. The load injury model that we saw. So when the load exceeds the capacity of the tissue, you will get an injury. But we need to play a little bit with the load, because also if we don't give load to the tissue, the atrophy will start coming. So we always need to give load, the correct load, so then any tissue can become stronger and stronger and more resilient to any injury. Next one. So what can you do to prevent muscle injuries? We can do many things. But again, most important thing, it's adequate training plan. And that's our main focus nowadays in the football club. This is 90% of our work. And we have, this makes us, I can tell you as a football medicine doctor, my last years, I've been spending all the time studying training, because most of the time, the answer will be on the training load. And then to be able to argue with the coaches, we are always kind of the enemies from the coaches. We need to have knowledge in training as well. So the past years, I just focus on training to be able also to discuss with them and say, okay, you have many injuries in your squad because your training wasn't good. Don't blame the doctor. You should blame yourself. And I explain why. But you have to have this knowledge. And now we also have technology that will help us, and I will show you. Other things very important that we still do, especially muscular imbalance. We will do strength program to build the player, flexibility program, a lot of programs we can do. But the main thing is the training plan. That's my main message. So next one, please. And this changed everything. This is a GPS training track system. So if you see, even in this World Cup, most of the players, they will wear this on the back. They have a vest and they have this device. So this device, this is for a squad. Each of the players, they have this on the back. Then after the training session, the computer will analyze, and here it's a table, and it will tell you how many meters of sprint you did, how many meters of running you did, how many accelerations you did, how many decelerations you did. So this will give you an overview of the load. And if there's any mistakes, then you can see here and correct. Before this device was very difficult because the coach, I said to coach, coach comes to me. We have many injuries, doctor. We can't be like this. I need the players. And I say, okay, coach, I think you are training too much, or maybe you are training too less. And he said, no, I train, my training is very good. I don't have any issues. And I can't say more because we don't have this. So it's my word against his word. So we are stuck. Nowadays, no, I have this. And if he comes to me and say, doctor, why we have so many injuries? Say, okay, coach, sit with me. Let's check the numbers. See, this week, for some reason, you did double the loads that you usually do because you were angry with the players because they lost less much. And then instead of training one time per day, you make 2 sessions. And then now you have many injuries because you can't increase the load like this. So this really makes our life much easier. Next one. So we also make correction of muscular, especially imbalance, also postural, but mainly muscular. And this is the dynamometer. So I'm measuring the strength of the player. This is for the abductors. Here for the adductors, we do also for flexors, extensions. And this will help us mainly control all growing injuries. For knee injuries, quadriceps injuries, hamstring injury, we do isokinetic testing as well. It's also important. And if there's any imbalance, we will try to correct. Next one. We do some also postural correction. We try to adjust. It's not so important as load or strength, but we still look at this. Next one. And our strengths program, we have eccentric and concentric exercise. We always try to work on the full range of motion. We have to have a huge variety of exercises. It's important to have open kinetic chain, but also closed kinetic chain. Some will be more analytical, other will be more functional. So this is towards also, that's why the cooperation, for me, in my opinion, the cooperation between the physical medicine rehabilitation specialist and the physiotherapist is crucial. And I work as a team with my physiotherapists. They are always beside me and I'm always with them. We really need to build together the best rehabilitation program. So next one, please. So the flexibility program also, we do analytic stretching, we do ballistic stretching, we do muscle chain. It's important to have a good variety. It also depends on the player and also the feeling of you as a doctor and the physiotherapist. Next one, please. Lumbar pelvic stability, the core strengthening exercise. We all know that this region is very important. The transmission of forces between the upper body and the lower body crosses all over this region. So we always, for any problem, we always should have a place, even if it's 10 minutes, 50 minutes, that we will work our core strength, and we will do always this exercise. They are always useful for most of the injuries. So this is, as you see, is a very comprehensive program. If it's an hamstring injury, we will not focus only in the hamstring. No, we will work everything on the lower body. We'll work on the core. We'll work all over. Next one, please. Then the neuromuscular motor control exercises, you can do it as well, balance exercises. Also, they are useful. Next one. So how should we treat a muscle injury in a football player? And this is, I hope also, this is my second message for you. Because when I started my career in physical medicine rehabilitation, the way we treat muscle injury is totally different the way I'm treating now. Totally. It changed 100%. Like say it's 180 degrees it came. Okay, and we will look why. So just for me to tell you, when I was in my residency program, we studied a lot the physical agents, the electrotherapy, ultrasound devices, microwave, the athermy, we focus a lot on this. And we focus almost nothing or very little in exercise. And now is the opposite. Now we start focusing much, much more on the exercise, okay? So how should we treat a muscle injury? So next. So this is a muscle injury. You can see the player here running. He's like someone shoot him in the back. You see, and this is a typical hamstring injury. He runs and he puts his, I don't need even to check this player. From TV, I can tell he has a muscle injury in his hamstrings. And since he's sprinting, I bet his biceps femoris. Okay, so when a muscle injury happens, what really happens? So you have two things that the patient will complain. You will complain of pain and of functional impairment. You say, hey, doc, I have too much pain here and I cannot even walk properly. Two things, pain and functional impairment. And when we check, we see decrease of strength. You tell him, just bring, oh, I can't. He has a decrease in strength and he has a decrease in ROM flexibility. You try to stretch the muscle and you cannot. He feels pain. So this is what we have. So what can we do to recover, to treat this patient? Next slide, please. So we focus on two things. We have to recover the physical qualities. Which ones? The range of motion, the flexibility, and mainly the strength. We look to these two things. When we recover fully the strength and the flexibility, this is my player. He was just coming from an hamstring injury. And okay, we are happy when he's able to do this kind of sprint. He's a really fast player. He's one of the fastest in the world. This guy is from Netherlands. He still has a lot of injuries. So for him, what we focus all the time, recover strength for him and for anyone, and the flexibility. When you have a muscle injury, for sure you will lose strength. You have pain. What your mind, your body is really smart. When he feels pain somewhere, he will give a signal, inhibitory signal, for the muscle to be quiet. Obviously, if the muscle is quiet for a long time, the atrophy will come. So the main thing in a muscle injury is to recover the strength, because there will be for sure loss in strength. It happens the same with the flexibility, because he will not move for a while and he has also this decrease. So we focus on these two things. Another one. So this is, and you can have this diagram here also in my website. But this is to show you that people, they ask, okay, but how many he should be on the bed making more manual therapy for how long? When can he go to the gym? Where can he go to the gym? When can he join the team? And it's not about time. This is about progression criteria. So I have this table in my club there in the medical department for the players to see. Because they ask me, hey, doc, I have this injury. When do you think I will be able to go? 3 weeks, 4 weeks? Say, listen, you are able to join the team when you reach all these criteria. It's up to you now. It's not for me. When you can do all this, you join the team. Some players will take 3 weeks, other 4 weeks. Depends also on you. on your compliance to the treatment. It's also very important. So progression, we don't speak so much in terms of days, no? It's more the progression criteria that we go. Next one. So, and obviously, and you'll see these progression criteria are very, very important, and we always follow this. But we start treating hamstring injuries already and any muscle injuries from the beginning. First, they will be mainly in the clinic. They will do, of course, rest, cryo, electrotherapy, manual therapy. They will do very gentle activation exercises. But at the same time, because they are athletes and they start to lose fitness, okay, if the injury is in the lower limb, they can do things in the upper body. They can do upper body cycloergometer. They can do strength. So they start immediately working on upper body and also in core stability from the first moment. Then they jump to the gym, and this is a really crucial moment. They will spend a lot of time in the gym, and when they reach the criteria, this progression criteria, they will go for the pitch. And once they go still with the doctor and the physiotherapist on the pitch, they will stay a long time as well in the pitch. They complete the pitch also with the gym, but only when they fulfill all the criteria, they will be able to join the team. So always like this: clinic, gym, pitch, and always with the doctor and physiotherapist. And only after this, they can join the team. So you, as a team doctor, when you work, you are not only work in a clinic. You sometimes spend your time in the clinic, or most of your time you will spend also in the gym and in the pitch. Next one, please. So this is the main key for muscle injuries, and this is the message that I would like you to remember. When you remember me, I would like you to remember this message, okay, on muscle injuries. Rest, it's important, and then therapeutic exercise. Rest and exercise are the most important thing in a muscle injury, okay? Rest in the beginning, obviously when the player is in the inflammatory phase acute, you just say, okay, be quiet, just rest. Because if you try to do something, you will increase the bleeding, you can have secondary damage. So to rest is very important in the first days. Then when this inflammatory phase is gone, then you will start with exercise, and you take exercise until the end. This is your main weapon for muscle injuries, is exercise, okay? Because the muscle fibers, the most strongest stimulus they will have is exercise for the proliferation and for the remodeling. They need this. This is the thing that the myocytes, they will grow with this. They will duplicate it, they will replicate with this. So exercise, step by step, is the most powerful weapon. Okay. So another one, please. So early stages, okay, this is a very nice facility. I used to work in, I don't have this now. I used to work in Dubai. This was in Dubai. So in Dubai, they have very good equipment. They have very good facilities. So this is an anti-gravity treadmill, swimming pool. So very early, we can already start with the player doing some exercise to give this stimulus to the fibers. Okay, next one. We can do already, as you've seen from the beginning, can start also with motor control. We can progress for flexibility. We can do the stroke or strengthening. Next one. Obviously here, our strength program is still going on. Next slide. And then here you see in the latest stages, we will finish always with this eccentric exercise. We've seen why they are more powerful. They put more strength, but this also kind of ballistic exercise, more functional exercise. And then it's also for your imagination to try to bring the better exercise for each player. And nowadays you can find so many exercises. You just need to look, and it's so easy. Next one. And then when the player, you've seen, has gone through the stages of the clinic and also from the gym, then he'll go for the pitch. And here is the pitch, is also still with us. Okay. For instance, this player here, after an hamstring injury, it's important. He was sprinting, he must do sprinting with us. And what we do, and this is the GPS data, we know that this player normally in one game he does 1 kilometer of high-speed running, high speed, like kind of sprinting, a little bit less. It's high-speed running is more than 20 kilometers per hour, and this is a very good predictor of injury. So I know that this player, he runs 1 kilometer per game above 20 kilometers per hour, and this is running is very demanding for the hamstring, and he got an injury with this. So what I will do, I will build up progressively this player. First day, he will do maybe 200 meters, then he rests. After 2 days, he will do 500 meters, then 800 meters. And then when he reaches almost his target, his normal target, 1000 meters, 1 kilometer, then he joined the team. So this phase is very important to control this phase. And we control this. And then he's ready to join the training. Nowadays, we don't tell anymore, hey, coach, you can join, but slowly, step by step. No, we don't do this because now we have these markers and we can be very accurate. So once he goes to the pitch, I know he did already 1 kilometer high-speed running, he can handle it. So he's ready to go. Next one, please. So we have obviously the complementary treatments, and you can use them. It depends on your experience. You are more experienced with one than the others. It's up to you. And we still use them. Some players, they feel more confident with other things. For instance, with hydrotherapy, someone they really like monotherapy, others they like acupuncture, others they hate it. So we don't do it. Depends on the patient and on you. Next one, please. So monotherapy, it depends with what kind of material you want to use. It's up also to the experience of physiotherapists, and that's why we need to speak with them. Next one. So electrotherapy, you see this also in Dubai, the amount of devices I have here. No. So to be honest, I barely use them. But the gym, I was using all the time, okay? Here, I will just use a couple of devices for a couple of days. The most important thing is in the gym. Next one, please. Hydrotherapy, also contrast bath, cold therapy. We will know about that. We still use it. Next one. Acupuncture or dry needling. Some players, they like it. Some players, they love it and they will ask. They feel much comfortable, they feel relaxed. Other players, they don't like needles at all, so we don't use it. Taping, especially the kinesio taping, some players, they feel more comfortable. Some physios, they like to use it, others not so much. But that depends on the player and on the physiotherapist. Next one. Then important thing, especially for the doctors, because from the past, we are very used also to give some tablets or injections to our patients. So in muscle injuries is different. Let's go. Another one. So anti-inflammatories. When I started my career, muscle injury, we start with anti-inflammatory. Nowadays, not anymore. Okay. Nowadays, what we will try is that the player avoids the anti-inflammatory drugs. We know that they can interfere with the healing. Okay. And so if we can, we try not to use it. So we can use it maybe just in the beginning if he has really pain and if it's a big injury with a big inflammatory process, then we can give anti-inflammatory just to control a little bit in the beginning. If it's a minor injury and the player is quite comfortable, we will not use. So be very mindful when you use the anti-inflammatories. And if you use it only for the first 2 days. 2-3 days is enough. Okay. Then if you continue using it, you might interfere with the healing process. Next one. So PRP, this is very common. There was so many, I did this so many times. It's a very complicated subject because there are so many brands, so many protocols. But there's an article in the New England Journal of Medicine, and they haven't still shown any benefits of PRP. They are not. So I did a lot in the past. I'm not doing anymore. And to be honest, this is New England Journal. It's a good journal. But also from my clinical practice, it's minor, but I did a lot and I didn't feel that it was improving my patients. So I stopped doing it. So next slide. I tried still different things like stem cells, stromal, lactovegan, collagen, prolotherapy, suramine. I tried so many things that were in the literature. They seemed promising, but in the end, no, they didn't result. Until now, maybe in the future it will come. And I was used to do a lot, and I still do ultrasound guided injection, because of course, if we are going to do a muscle injury injection, then we should use ultrasound. So we need to put exactly the product in the injury, you know. But to be honest, I try them all, and for me, they still don't show any benefits. So focus on exercise. Next one. So this is only the key message in my last slide. Last slide. So people, they minimize muscle injuries, but we see that they have a very high burden in football. Okay, we have so many muscle injuries. Players, some players, even they finish their careers because of muscle injuries. Some players, they get so many muscle injuries that they don't get their opportunities with the coach. They lose. So they are still important. Prevention is the loads. Always look to the loads. Please don't let, when the patient comes, you know already that's a mistake. If you are working in the club, you have to try to be friend with your coach and try to tell him about the load and the precautions that you should have. Clinical diagnosis, we've seen 3 steps, very easy: palpation, range of motion, strength. If you go for an ultrasound or MRI you can do a little bit early. Ultrasounds, ideally 48 hours. Don't be in a rush. Everybody is putting pressure, but 48 hours is needed to have a good image. And treatment, as we saw, first rest, then exercise. Next one. Thank you. I think is the last. Thank you very much.
Thank you, Professor Joel.
Sorry, just to hand, this is okay. My website is not in profit, nothing. I just spend money with this, nothing more. So it's www.footballmedicine.net, and you have many information always regarding football medicine. Thank you so much.
Thank you, Professor Joel. And as we about to continue today's event, would anyone like to give an insight or question about the lecture, please? Or Dr. Bayu, maybe?
Yes, I would like to ask. I have an experience last season. I had a player who had pain on the front thigh. I've suspected, I think this is a rectus femoris injury. And in the team setting, we usually will meet a condition like, I must play, I cannot rest now, doctor. And not only the player is saying that, also the coaches. Yes, so what I'd like to ask is, one, how do you draw the line when we must say, no, you cannot, or yes, you can, but maybe we need to do something? And the second I'd like to ask is, I'm still regretting my decision with this player, because since he is begging me, and also the coaches were begging me to play him, and then maybe we can do some NSAID injection to reduce your pain. And then the second game he had that injection, he finished the game with some swelling, and then we do the MRI, 50% tear to the rectus femoris. So how do you view about the NSAID injection? Thank you.
So first, thank you very much for your question. It's a very, very good question. Very good question. And it's a question that all the people, all the doctors working in football, it's not only you, all without exception, 100% have this problem. This will always happen, okay? So what I do, for me, I try always I have a thing that I always think about in me is like, I do 2 things in my practice. I try to keep things stupid simple. For me, I try, okay, let's try to bring it really, really simple. And the other thing, I think, oh, okay, if it was my son or my brother, what I would do. This always, I think, I have always this in mind when I take my decisions. always this. So for me, very easy. When it's a player under 18, I just will tell, no, you cannot play. Finish. Okay. When he's above 18, it's different. Okay. When he's above 18, what I will do, I will make a meeting. Okay. And communication here is key. A meeting between me, the player, the coach, and even sometimes the sports director, because this can interfere with all. I make a meeting when they ask me this, I need to play, I want to play. And I say, listen, the problem is this. You have this injury, and I want you to be totally aware that you might play, but you might aggravate the injury, and this and this and this might happen. So I put all the scenarios. Okay, if you decide to play, don't forget now your injury, it's a grade 1B, for instance, and it will take 2 to 3 weeks to get totally recovered without any scars for the future. If you want to play, this injury, maybe after the game, will be a 3B injury, and it will take 2 months or 2 months and a half to recover. And maybe even you will have some impairment for the future. So I put this clear. Then it's up to the coach, to the player to decide. That's what I do. No, they have to be totally aware of the decisions that they will take. And because of course it depends. Some players, they see, hey doc, but it's the final of the Champions League and I want to play. It's my last match, and they want to take the risk. Okay, but they need to be aware of the risks. That's the most important. So my advice is good communication. Player, at least player and the coach, and you tell him this what will happen, might happen, and then that's their decision.
And what is your opinion about NSID injection? A few decades before, every player that wants to play, sometimes they get let's say a ketoprofen injection, something like that. How do you view that nowadays?
No, it's a very good question. It's a difficult question, and what we know from the evidence, that's in terms of to work as a painkiller, to give it orally or as an injection is very similar, the effect. Okay, so, but sometimes the player, he feels more comfortable. You have also this kind of placebo effect of the injection. So he thinks if he takes a diclofenac injection, is much better than taking oral. Yeah, and it's not. The levels then in the bloodstream will be almost the same. But they feel, oh, I took an injection. Okay, they feel. So if they are totally aware of the consequences, okay, I can help them. Okay, but they need to be totally aware of the consequences. That's the most important thing, and the risks. Okay,
Thank you.
But normally, to be honest, if the muscle injury, normally in a muscle injury, especially if it's an hamstring injury, the anti-inflammatory, it will not interfere much in the feeling of the player. The impairment is quite high, and nowadays, if the team is very competitive, if they have a good player to replace this player, or even not so good, but an average, then the coach maybe he prefer an healthy player that can perform 100% than to have a player with a muscle injury performing 80%. Because you can never put a player with a muscle injury, even with all the painkillers that you can give, performing 100%. And then I tell this to the coach also, coach, you want this player? You won't be 100%, but if for you it's 80 is enough, maybe you can try. Yeah.
Thank you, Doctor.
Okay, thank you for the well explanation, Professor. Maybe another question, or the question in Zoom, maybe. Okay, Dr. Bayu, monggo dokter. Yes.
Thank you very much. Apa namanya? Namanya apa?
Dr. Joao, Dr. Joao.
Thank you very much, Dr. Joao, for joining. It's an excellent lecture about football medicine. Especially the football player here. Are you? You? Oh, you. Because especially this is because your lecture is stresses on the professional football. Okay, we are all not professional.
Yes.
Okay, but it is very important. As Dr. Joao lecture, I stress it once again and again. In physical medicine and rehabilitation, topic of kinesiology, biomechanics is very, very important, this one. Because all according Dr. Joao,
Wow.
so
Yes.
all about especially about muscle injury, biomechanics is very, very important. Okay, so especially the young resident, I says it again and again, kinesiology or biomechanics is very, very important. Okay, now, Dr. Joao, there's a habit of our football players. I think this is not a good habit. We look the process of injury, okay, like your picture there. We show that there is muscle injury, okay, but the player, oh no problem, no problem. No. I was just kind of. Is it a good habit or not habit, or worse habit? Because we know very well from the process of injury, I believe that this is muscle injury, but the player is the no problem, no problem. Is it good habit or not good habit?
No.
So what I understand from your lecture, if there is a muscle injury, you should stop and rest. Is it?
Totally. Yes, 100%. Yes, thank you. Yeah, it's absolutely, because if you continue, it will progress.
Yeah.
From the beginning, obviously it needs rest.
Yeah.
And it needs to stop the
Yeah.
activity.
But well, you said that the relationship between the doctor and the coach is very, very important. But usually the coach, okay, you play, carry on, and the coach is set like that. So dari situ the what relationship between medical doctor, physiatrist with the coach is very, very important. Okay, and the coach has to follow the advice of the doctor, of course. Okay, and now the next question. Sorry, Dr. Joe. This is about the professional football. Okay. No, is there any advice for us who is not professional but there is a weekend football player?
There is.
Any
Yes.
advice for them?
Yes. So this is, and for instance, in Portugal, I don't know, here I don't think you have. We have one thing called we have a congress medical. One time, it's 1 week per year. So all the doctors will go to one place.
Oh yeah.
And for 1 week, we kill ourselves playing sports. So we make teams and we challenge all the teams. And then sometimes even we make 3 games per day.
Oh.
So what happens? Very simple. It's 1 week. We play 7 aside. No, so our squad is like 14 players. Normally, the team who goes for the final will reach the final only with 6. All the others are injured. We don't have. Sometimes we cannot play the final. There's no player. And why is the load? Because these players, they are playing 1 time per week, 2 times per week. And in this week, they play 2 games in 1 day, and next day again, and next day again. So injuries, and big injuries, muscle injuries, ACL, Achilles rupture, the worst injuries, because what we call the chronic load of these doctors, it's 1 game per week. This is the chronic load. So they are used to play 1 time per week. No problem. They can handle this. But the moment they are going to play 6 times per week, the injuries will come for almost all of them. Some, they will not get injury because maybe they are playing a lot and they have a good chronic load, and genetic also is important. Some guys, for some reason, they can stay away. So load also for us, recreational players, is important. That's why, and Raka, our venue medical officer, he can confirm this. When I got to, usually I play 1 time per week, maximum 2 times. This is my chronic load. So when I'm for this tournament, almost 1 month, I know that for me, when I go back not to get injury, I should try to play. And I asked Raka, can I play here? That's why I play with you as well. And we have been playing. And one of the reasons I ask is to maintain my chronic load. Okay?
Okay, thank you very much.
Yes, minimum.
Thank you for this explanation. Nowadays, there is a popular sport here in Indonesia, just like football, but we call it futsal. Apa namanya? Futsal. You know futsal?
Yes, I played.
Because my grandchild is also playing football. Oh, futsal. What happened? They come to the place and then directly play without any warm up without any. Is it very dangerous, right? Football, futsal.
Yes. So actually, I never played football, 11-a-side. I played futsal in the college. Yeah, I was in the futsal team. So the main thing of the warm-up is really to put us warm and to be prepared for the game. You know? Obviously, warming up in Indonesia is totally different of warming up in Iceland or in Germany, because the temperature interferes a lot with the tissues as well, especially the tendons and the muscles and the aponeurosis. They react to the temperature. So obviously, I think when you can do a warm up, it's always good to prepare your body for the exercise. But obviously, a warm up that in Germany or in the north of Europe will take 15 minutes. Here, 4 or 5 minutes warm up in this country with this weather and humidity is totally enough. And futsal, by the way, just the injuries are a little bit different in football. We get less injuries for one reason. The pitch is shorter. So you get some speed, but you never get a full speed. No, because for you to reach like your maximum speed, you need at least 30 meters, and you don't have this running in football. So the contacts, the speed and the power is a little bit less. You get a little bit less injuries.
But on the other hand, the fit is quite hard. It's not
hard.
That's in futsal.
Yes.
Is it dangerous?
Yeah, it always depends. It's the load. No, if your body. That's why, for instance, even if you are in a futsal player, if you can have good muscles, it's always important because the muscles will absorb the impact for the joints. But you are right. Playing in a hard surface for your joints is not so good as playing a little bit soft surface. No, and especially because also the futsal players, they have this in their minds. Sometimes they like to use very thin shoes.
That's
very
right.
thin
That's
shoes.
Right. That's right.
So there's no cushion. The impact, it's strong. But obviously, if you can put your body adapt to this, then it will be very strong. You can hold. If your body is not adapt, you can get injuries very quickly, like stress fractures and joint problems.
Kamu pemain futsal kan? Iya kan? Hati-hati lo ya. Okay. Thank you very much, Dr. Joao. Any other question?
Thank you, Dr. Bayu. And because we airing online, Doctor, in YouTube, there is some question on Zoom from our beloved physiotherapist, Pak Jatmiko. He asked, in our practice, we always found the chronic condition in muscle injury with bulk muscle and pain with palpation. Based on your experience, what is the most effective of treatment for this issue? In our practice, we always found the chronic condition in muscle injury with bulk muscle and pain with palpation. And based on your experience, what is the most effective of treatment?
Yes, so it's the same. It's always the same answer. So even in a you can have a bulk, you can have a very big injury. Doesn't matter. What you really need to do in the first days, it's rest. Of course, according to your expertise, you can use other things, massage, manual therapy. It will help a little bit. But if you don't rest, forget the rest. And then exercise. You can do everything else, electrotherapy, manual therapy, all the things. If you don't do the exercise, if you don't build up the strength and the flexibility, so the physical qualities of the muscle, if you don't bring them back, the player will never be good. And what will happen is the pain will go away at one moment. You say, okay, the player is ready, and he's not. He goes inside and injury again, a re-injury. And it's very common. It's a big problem in muscle injuries because the pain will go away after a couple of days, but the strength is not there and the flexibility is not there. And this is a big mistake. That's why we have so many re-injuries. The pain is gone. You don't have pain. Okay, you can go play. And then re-injury.
There is another question, doctor, from Zoom, from Fadli Faisal. And how can we difference the muscle pain at causa damaged muscle by the muscle hypertrophy and muscle injury? And here it at your slide that the muscle injury happened because an exit load and get damage to the muscle. What difference between two of them? Do our treatment for muscle injury pain and muscle hypertrophy damage pain is the same? He asked about
muscle atrophy and muscle injury.
Yes, doctor.
Yeah, it's the same because one brings another. No, so as I told before, like the moment you have pain and you have an injury, your brain will give inhibitory signs to the muscle, saying the muscle don't move, don't contract, and atrophy will necessarily come. So to overcome this, obviously, treatment always the same. Exercise, build up strength, step by step. Start with very gentle exercise, probably first steps with isometric, and you start building up with concentrics. And as we saw, the last ones, the eccentrics, they are more demanding.
Thank you, doctor, for the well explanation. Ladies and gentlemen, senior doctor, and all my colleagues, I hope you find today's lecture informative and useful. Before we close this evening event, may we please have our guest lecturer, Professor Zhuo, and Dr. Bayu, to come to the front to the commemorative souvenir, doctor. Please give applause.
Thank you. Thank you very much. Thank you so much.
Give applause, please.
And I hope that you also don't forget me, especially my special message. Don't forget the importance, as Doctor said very well, study well anatomy, biomechanics, kinesiology. It's really important, is the key for your future and not only muscle injuries, but most of the injuries that you will get. Thank you so much.
Once again, we thank you, Professor Luo, for your time in Surabaya. And now we would like to ask our guest lecturer and all the participants and all the senior doctor to take a picture in front of here.
Well, this is from the university. Yes.